There are also different activities that can rapidly assess an individual. So particularly for school sports programs. So if you're a physical therapy office and you have TRAZER and you want to do outreach to a school, what you can do is you can transport your TRAZER. There's no special calibration required. And you can do two different drills. One is the Agility 90 drill and the other is the lateral shuffle drill. Using this drill, we can rapidly assess within 90 seconds an individual's acceleration, deceleration, speed, reaction time, and heart rate. Then you can track an athlete longitudinally over time. The other thing that's particularly helpful for a physical therapy office is if they perform the baseline with that student athlete, then to go for treatment, they're likely to go to that physical therapy office because they own the data and the health record. With regard to reports, going into the Agility 90 as an example, you can compare the baseline, so it always defaults to the earliest activity for that. Every time you do an activity, a date time stamps that activity so you can track it longitudinally over time. So if this was the baseline and this was preseason and this is the current activity, I can simply go to select baseline, click on that, and then go in and pick a different point in time for comparison. So if you watch the numbers here, once I click that, these numbers are going to change. So you saw the change. So you can compare any previous point in time to the current point in time. In the cloud, you can go in and you can pull reports from any point in time and compare one report to another or multiple reports. Now, tracking the individual over time, you simply go into the history. So what it does is it provides a longitudinal graph on either improvement or degradation of an individual. So whether it's treatment, athletic performance, or something else, you can track somebody over time. As I mentioned, each point in time where an activity is completed is date time stamped. The different aspects that are measured are time spent on the activity, the distance traveled during the activity, speed as in feet per second, acceleration in feet per second, deceleration in feet per second, reaction time in seconds, and then heart rate over that period of time, if it's measured. To further illustrate this capability, if you go into the vector report, as I mentioned, it defaults to the earliest point in time. So you see the way that the person has moved during this activity, right, as a graphical representation. So if you look at this, and I go in to select a previous baseline, you'll see how the pattern changed in the blue area, which indicates a previous baseline in time compared to red, which is the current activity. And then again, it provides asymmetry of movement from that previous point in time to the current point in time to determine if a person's asymmetry is decreased, thereby making them less at risk for injury, or is increased. This is also helpful from a PT's perspective. Normally, when somebody experiences 20 to 30% asymmetry after an injury, the pain has disappeared. A physical therapy clinic or an orthopedic surgeon or whomever can go in and see if they've recovered to a certain point or not. So even though the patient may feel that they've appropriately recovered, you can show them that they still need 1 or 2 sessions to complete that full recovery. That improves patient outcomes, it's evidence-based medicine, and it also helps with insurance companies. So whether you're applying to an insurance company asking for additional sessions, you can quantify that through objective reports rather than just subjective assessments. It also helps with MIPS, which is a merit incentive payment system through Medicare and Medicaid to increase your revenue, increase generating your revenue through objective outcomes and improve patient experience.